how good is the brain at rewiring itself that we keep hearing about?
Correct. So rehab definitely works. So it's different if you have a stroke that affects a very specialized area where the brain cells around that area might have a harder time learning to do the things that that very specialized brain cell did. It's also different if you have a smaller stroke, so the area of injury is small, and the brain cells that remain are able to pick up that work. You still have to do, it's like learning learning to ride a bicycle again in many ways. So you still have to undergo that process, but recovery will depend on the size of the stroke, the location of the stroke, and also your age. If you're younger, you do have better
More
ability,
tools to
plasticity, we
recover.
call it, to recover.
And how often does someone have a stroke and not recognize they have a stroke and they go on with their life? And I imagine that puts them at risk for a bigger stroke later.
Yes, you're absolutely right on both things. So one thing is again, location. Location, right? So there's areas of the brain that are specifically targeted to awareness, and we call that neglect. Neglect is the medical term for this, but you don't recognize a space. So we've had patients that have a stroke on the posterior part of the right brain, the parietal lobe, and they don't realize anything on the opposite side. So on the left side, if they have a right-sided stroke, and they feel like they can get up and walk, when in fact they can't move anything on their left side. And you see them on the bed, they're trying to get off, and you know they're going to fall, but they don't realize that.
They don't recognize that.
So that things along those lines can happen. And again, that's why it's important for people, not just you in particular, but for those around you, to understand what a stroke is and how it presents.